So today we have a total of 112 active cases in relation to the Shepparton outbreak. That's an increase of 5 from yesterday, and there's still more people based on the results that are coming through so far today. There's further positive results coming through for people who have contracted COVID-19, unfortunately. We're now well over 95 exposure sites in Shepparton. There is still some more exposure sites being published on the Department of Health's website. That's the single source of truth, as where people should be monitoring and keeping an eye on exposure sites, because they are changing regularly, and of course anyone who's been to a tier 1 or 2 site needs to get tested, and of course we don't want people to not get tested because that helps us detect what's happening with the outbreak. So again, anyone who has symptoms of COVID, no matter how mild they are, we want them to come forward and get tested straight away and not put it off, not even for half a day, half an hour. Come forward and get it done straight away. There's plenty of access to testing in Shepparton and Mooroopna at the moment, as indeed there is to many other testing sites right across the state as well. And again, the Department of Health's website, coronavirus.vic.gov.au, is the best place to find testing locations as well. Tomorrow is the day 13 testing peak that we're looking forward to in regards to having as many people come through that process as quickly and smoothly as possible. We're expecting there's going to be in the order of 4,000 people that will require testing tomorrow, and largely they'll be from a couple of the school sites which have large numbers of people associated with those sites. A couple of important things to note in relation to day 13 testing, particularly for the school sites, is that it's only the primary close contact that requires testing. It's not therefore all other members of that household that require testing. So it'll generally be the student, or if there's more than one student in a household, the students that need to be tested, not the household members as well. The only caveat or exclusion that we would place on that, of course, is that if anyone has symptoms, of course, they should be tested as well. In terms of the planning and the logistics, so we have a process in place. All of the information about the extended hours for our testing sites, and also where the testing sites are, and in terms of what time they open, is all on our GV Health Facebook pages, and people are encouraged to monitor that site during the course of the day, because we will be posting information in there about wait times across the various sites. But the addresses, the opening times, the closing times will all be there. We will have 2 or 3 sites open until 8 o'clock at night, and we will go longer if we need to in order to meet the demand. In terms of meeting that demand and keeping the queues to a minimum, what we're asking community members to do is to follow some advice that we've provided through the school networks, and also that again is available on our Facebook pages. So the exposure sites for Boucher Street Primary School, St Mel's Primary School, and also for the Greater Shepparton Secondary College campuses of Maguire and Wanganui. So all of those schools, particularly for Maguire and Wanganui, year levels 7 to 9, in addition to the 2 primary schools, we're asking people to come from 8 o'clock in the morning to be tested at any site, whichever's the one that's most convenient. So people to come forward from 8 till 1, and then from 1 p.m. onwards, years 10 to 12 from the Maguire and Wanganui campuses of Greater Shepparton Secondary College, but also for Notre Dame as well. Doesn't necessarily mean that everyone has to turn up at 8 o'clock or at 1 p.m. You can turn up at 9 or 10 a.m. Or at 2 or 3 p.m. and stagger that across the course of the day. What again we're asking people to do is to bring a book, an iPad or something like that, to pass the time. Hopefully we can keep the waiting times to a minimum. That's certainly our goal, but also bring perhaps something to eat and drink as well, just to be sure, particularly if there's kids in the cars. In terms of clearance for people once they're reaching the end of their quarantine period, it's a two-step process, and people really need to pay attention to what that actually means, in the sense that you'll get a message from the pathology provider regarding what your test result is. So if your test result is negative, that doesn't mean you're automatically released from quarantine at the end of your day 14 period. You still need to receive a second message, whether that be a text message or an email or other communication from the Department of Health, that authorises or releases you from your quarantine period. So it's a two-step process. Step one's the negative test result, hopefully, and then step two is the formal authorisation from the Department of Health. So people really just pay attention to that, please, because don't think when you get the negative test result that you're free to go. You just need to wait a little bit longer, and generally that'll be within 1 to 2 days of that pathology result coming through. And then finally, if people do test positive, that's a different pathway in terms of their day 13 testing. We know from the experience in other outbreaks in Melbourne in particular that unfortunately there are some people who have tested positive at day 13. So if that happens, if someone does test positive at that point, they'll then receive an additional phone call and contact from the contact tracing team. Then finally, of course, vaccination is key to all of this. We are really wanting to make sure that people get vaccinated. There's plenty of access to vaccination sites, both through the state hubs, which can be booked on 1800 675 398, or again the coronavirus.vic.gov.au website. Or there's plenty of other access at GP clinics. So, there's GP clinics, many in Shepparton, that are now available to administer vaccinations, and pharmacies as well. So I'll leave it there and happy to take any questions.
Do you see the outbreak starting to plateau? Do you think we had 9 cases yesterday, we have 5 today? Do you think it will decrease as the days go on?
It's encouraging to have a smaller number of people testing positive. Again, those people who have tested positive, there is links and known cases in terms of how they've become exposed to the virus. So perhaps except for one that's still undergoing contact tracing of those 3 new cases today. It is encouraging to have only 3, a smaller number, but while there's still people testing positive, I guess it is a concern, and we'd obviously like that number to be 0, and then we can keep driving it down then in terms of the overall number of active cases in the coming days.
How many households are currently involved in the outbreak?
Beg your pardon? How many
households?
Around about 45 households now are involved in the outbreak, yep.
What are your thoughts on Shepparton possibly being excluded from the regional lockdown being lifted next week?
Have I seen that?
Yeah, what are your thoughts on Shepparton possibly being excluded from that lifting of the lockdown?
I haven't actually seen what's been announced formally today, but I think what is important in terms of the decision making, as I understand it, is really it's about safety first. And as we've seen with the pandemic and how quickly the Delta variant can spread, and we've seen that in Shepparton in the last 2 or 3 weeks, and elsewhere, of course, in Melbourne and New South Wales. So in regards to any decision making about lockdowns, that's obviously a decision for the state government, but my sense is that really what's driving that is safety first, and I know there's a balance in terms of the public health requirements, but also in terms of people's livelihoods and trying to strike that balance. But we've got to just be mindful of how quickly this virus can spread and how dangerous it is for people who are contracting it.
Dan Andrews today signalled that Victoria as a whole won't ever really get back to 0 cases at this stage. Do you reckon Shepparton can get to 0 before in the next couple of weeks or next month or so?
It's possible, and that's certainly what we'd be aiming for at the minute. I think, to be fair though, at the moment with 115 or 16 cases and the numbers are still going up, it's unlikely that that's going to occur for a number of weeks. So, we'll see. It will be interesting to see just what happens in the early part of next week, particularly over the weekend after the day 13 testing occurs, and then the surveillance testing for people that have tested positive, just where it's placed. But I think, we should be expecting that there's going to be positive cases in Shepparton for a good few weeks to come at the moment.
Do you have a rough indication, how many positive tests might come in after that day 13? Are we expecting everyone in those 45 households to come back positive? Are we expecting a significant bump or just a modest bump? Or
It's a bit difficult to say. I think so in relation to it's a bit of a delineation between the primary close contacts and secondary close contacts. So primary close contacts, it may not be as high a strike rate as such, but where you've got people who are positive in a household, I think that's a different story. So where you've got primary close contacts, say from a school setting, and there's no one else positive in the house, it's probably less likely. But if you've got people who have been positive in a household, it's a different story, because that's certainly what we're seeing, is that the spread of people turning positive or contracting coronavirus in households is really high.
have we had any people going to hospital in Shepparton?
We've had a number of people, so far we've transferred 9 people to Melbourne for higher levels of care. At the moment we have 2 inpatients that are being cared for at GV Health, and we've had a number of people coming in and out for hospital admission and or treatment in the emergency department, and then they've thankfully been well enough to be discharged home.
Thank you.
Thank you.